So I had someone ask a good question about what biomarkers are. And that is a term that's often thrown around, but essentially they represent data points that we can glean about our body. This could be a biomarker on a blood test. It could be a biomarker on a salivary test. It could be a reading from your Fitbit. It could be a reading from your continuous glucose monitor. It could be a reading from any other wearable that you use. It could be tracking your sleep or your HRV. Essentially, all of those are biomarkers. And then the way that we use these is, especially if you're using like a wearable tech, this is when you can notice how things affect you at home. And then you can start to track how your metabolism reacts depending on what you're eating or how you eat it or what form or if you exercise around it, things like that. And there's so many different ones. There's like Fitbit, Oura Ring, Whoop. There's the continuous glucose monitors that I mentioned. There's another thing from something called Lumen that I also really like, and it measures your breath, and that way it measures your metabolism without putting anything into your body. But all of them have different benefits to their data points. But that's the way that you can think of them, right? Is biomarkers are pieces of objective data about ourselves that we can then use to alter and modify our behavior for our best interest.